Hello, I'm Kathleen Maiman. The T.H. Maiman Award for Research Excellence was created for outstanding lifelong contributions to developments in light therapies. We honor James Carroll for this award today. Ted would be very pleased, as the applications for laser technology to medicine were his top passion after he developed the world's first laser in 1960. Not only is James Carroll an outstanding scientist, he is a delightful person to know. James Carroll has been working on photobiomodulation for 34 years and is a recognized authority on dose rate effects, and the measurement and reporting of treatment parameters. He has written or co-authored 24 academic papers and co-authored 4 books in the field. His most recent appointments include being co-chair of the Biomedical Optics Society Conference on PBM mechanisms, board member of the World Association for PBM Therapy, and is a fellow of the Royal Society of Medicine. Through his company, Thor Photomedicine, James is working with 36 medical institutions across the world, including Harvard Medical School, St. Jude's Children's Hospital, and the UK National Health Service on treatment for a range of conditions such as traumatic brain injury, the side effects of cancer treatments, and managing acute and chronic pain. James has presented to the United Nations Global Health Impact Forum and Congress on PBM treatments that could solve the opioid crisis. Today we honor James with ALD's highest award for research excellence.
Fantastic. Thank you. This is amazing. And thank you for such a generous and flattering introduction. My words up. So thank you, thank you, Kathleen, and thank you to ALD for this prestigious award. I'm also grateful to the hundreds of scientists and doctors and their patients for this special moment in my life. Kathleen, we are all indebted to your late husband, Ted Maiman, for inventing, building, and patenting the world's first laser back in 1960. Just 7 years later, Professor Andre Mester discovered that low-intensity laser treatment improves the speed and quality of tissue repair via a mechanism that today we call photobiomodulation, or PBM for short. We now know that PBM also reduces inflammation and reduces pain. And there are early indications that PBM helps improve the function of the central nervous system for debilitating conditions such as macular degeneration, brain injury, dementia, and even Parkinson's disease. I first heard about PBM in 1987 from Andre's son, Adam Mester, who presented evidence of 1,361 patients successfully treated with PBM at his father's hospital. Right then, I knew that PBM should be in every hospital in the world, and I've been working to achieve that goal ever since. PBM has now been validated in 700 randomized controlled clinical trials on humans, and my Thor products have delivered over 30 million treatments. A patient named Judith wrote to me saying, 30 years ago, I was hit by a car which broke my collarbone and injured my shoulder. Decades later, the pain still required 8 anti-inflammatory pills every day. And eventually I could not use my arm. But PBM therapy saved my life. I no longer need painkillers because I live pain-free. So please thank everyone who helped bring this technology to people like me. It's been a miracle. Now, it's letters like that which inspired me to establish the goal of having PBM accepted as a first-line medical treatment for 100 different diseases in 100 different countries by the time I'm 100 years old. PBM is like something out of science fiction, but Ted Maiman and Andre Mester made it a reality. And I look forward to continuing this quest with all of you as we make PBM a standard of care globally. Thank you, Kathleen, and thank you, ALD.